हेलो दोस्तों, वेलकम टू आरजे वो स्टडी वर्ल्ड। आज हम लोग डिस्कस करने वाले हैं मीजल्स के बारे में। तो मीजल्स एक बहुत ही कम्युनिकेबल डिजीज है, तो इसके बारे में आज हम लोग केयर प्लान बनाएंगे। तो आप लोग फर्स्ट ही देख सकते हो, फर्स्ट पेज जो फ्रंट पेज होता है वो कुछ इस तरीके से बना लेना है आप लोगों को। ओके, फर्स्ट पेज में आप लोगों को लिखना है आइडेंटिफिकेशन डेटा। अंडर आइडेंटिफिकेशन डेटा, नेम, एज, सेक्स, हॉस्पिटल नंबर, एडमिनिस्ट्रेशन डेट, वार्ड, date of birth, place of birth, gestational age, birth weight, name of father, occupation, name of mother, family income, address, religion, diagnosis, informant relation to child and language. नेक्स्ट आता है हमारा सेकंड पेज। फर्स्ट इज चीफ complaint. Baby's mother complained that the skin of the baby was rash and dry, and also he has fever, running nose and cough since 2 days back. In that case, patient admitted in pediatric ward. Next point is present medical history. Baby's mother noticed that the skin of the baby was rashes and dry and also having fever since 2 days. After investigation, baby has been diagnosed as measles. Next point is present surgical history. There is no significance of present surgical history. Past medical history. There is no significance at past medical history. Next point is past surgical history. There is no significance of past surgical history. Next, family history. There are 6 members in the family. Baby's grandfather was died and grandmother are healthy. Baby's father and mother both are healthy but malnourished. There is no having any past history of measles, and there is no having any communicable and hereditary disease. Next is family tree. आपका पेशेंट के अकॉर्डिंगली आपको ये बनाना है। नेक्स्ट इज सोशियो इकोनॉमिक हिस्ट्री। देयर आर 6 members in this family and his father is only working member in this family. There is proper lighting, proper ventilation, proper water supply, proper electricity supply, proper sanitation, proper drainage. नेक्स्ट इज फैमिली कंपोजिशन। आप देख सकते हो यहाँ पे आपका जो पेशेंट है उसका फैमिली के अकॉर्डिंगली आपको ये बनाना है। ओके, नेक्स्ट इज बर्थ हिस्ट्री। फर्स्ट पॉइंट इज एंटीनेटल हिस्ट्री। एज ऑफ मदर, मैरिड फिन, ब्लड ग्रुप, रेगुलर एंटीनेटल चेकअप, कंज्यूम्पशन ऑफ एफएसटी, फॉलिकल एसिड, टीटी इंजेक्शन, एनी एक्सपोजर टू टेरालोजन, एनी कॉम्प्लिकेशन, नो। Second point is natal history. Normal delivery, आपका score, place of delivery, mode of delivery, NVD, normal vaginal delivery. Then weight, condition of neonatal, any congenital deformity. Next, third point is postnatal history. Condition of mother, mother is malnourished, low weight. Condition of neonatal, meconium past urine within 24 hours, yes. Past urine, normally past urine, any information, no. Next, third subpoint is feeding. Initiation of breastfeeding immediately after birth within 30 minutes. Sucking reflex is good. Next is immunization history. At birth, name of the vaccine, BCG, hepatitis B and OPV. Then 6 week, OPV 123, pentavalent 123 एंड RBB। ये आपका पेशेंट का जो एज है उसके अकॉर्डिंगली आप लोगों को ये इम्यूनाइजेशन शेड्यूल बनाना है। नेक्स्ट इज डाइटरी न्यूट्रिशनल हिस्ट्री। बेबी ओनली टेकन breast milk, no other external food, breastfeeding given every 2 hours interval, whatever required. Sleeping habit, duration 18 to 20 hours daily, problem related to sleep, no. Next is alimentation pattern. No at urine frequently 20 to 22 hours. No at bowel movement 18 to 20 hours. Toilet train. No. Communication and socialization. Mother communicable good with patient, but patient is not communicable with others. Next point is response parents to child illness. Parental concept of diagnosis. Measles. Response of patient to illness. Anxious. Reaction of child to illness. Crying. Next is observation and assessment. Vital signs. Under vital signs, temperature, pulse, respiration, blood pressure. Next is anthropometric measurement. Head circumference 32 centimeter is normal. Chest circumference 31 centimeter is normal. Arm circumference 10 centimeter is normal. Height 42 centimeter is normal. Weight 2.5 kg is also normal. Next, degree of malnutrition. Next is refluxes. Rotting reflux is elated. Sucking reflux also elated. Next, tonic neck reflux, Moro reflux, palmar crux reflux, stepping, placing or dancing reflux, Babinski reflux, doll's eyes reflux, Gallant reflux, palmar reflux, plantar graph is also elated. All are elated. Next is physical examination. General appearance, lethargy, body build, fat, activity, no activity, emotional status, restlessness, posture, better. Next is skin condition. Skin color, red patches, temperature, 101 to 104 degree Fahrenheit, texture, dry, sugar, and elasticity is normal. Edema, no edema is present. Hair color is black, distribution normally distributed. Nails hygiene, maintain hygiene, clean nails. Condition normal, nail bed color is normal. Next is head. Head circumference is 33 centimeters normal. Frontal shape, shape is normal. Condition is also normal. Eyes. Eyebrows also normal. Eyelashes normally distributed. Eyelid normal brownish color. Shape and appearance of eye. O. Sclera normal color. Conjunctiva no infected. Cornea normal. Pupil normal. Vision unidentified. Next is ears. Position. Tap at the pira is on horizontal with the outer contour of the eye. Shape and size. Normal. Hearing normal. Nose. Size is normal. Shape not proper shape. Nasal septum no deviation. Nasal flooring normal. Mouth and throat. Lip. Skin color. Color is skin color normal. Teeth. One or two teeth is present. Oral mucus moist. Thumb. Skin color normal. Tongue. Skin color normal. Neck. Shaving of neck. Absent. Thyroid is normal. Lymph node is normal. Range of motion normal. Maintained. Next is chest. Respiratory rate 32 beats per minute. Breathing normal. Chest wall movement is normal. Lung. Next point is lung auscultation. Normal heart sound. S1 and S2 is present. Shape normal. Abdomen. Inspection. Scar. No scar. Shape normal. Lesion. No lesion. Umbilical. Umbilical is normal and cord is element and cut. Next, second subpoint is palpation. Liver also palpable. Spleen palpable. Tenderness no tenderness. Next, third subpoint is percussion. Resonance and temporary sound are present. Auscultation. Peristatic movement is also normal. Next, genital. Rectum is also normal. External genital not abnormal. Penis is also normal. Next point is back and spine. Normal, no uneverted extremities. Upper extremities, range of motion, normal. Syndactyl, no syndactyl. Polydactyl, no polydactyl. Waving of fingers, no. Clubbing of fingers, no. Lower extremities, range of motion is also normal. Parlow sign, no dislocation. Ortolan sign, no dislocation. Next is growth and development. Book picture, right side patient picture. Biomedical development. Weight, height, head circumference, chest circumference. Next is vital signs. Under vital signs, temperature, pulse, respiration, BP. Next, second point is motor development. Gross motor. Hand lying prone, lift head almost 45 degrees above, turn from side to back, symmetric posture of hand and body. Under patient picture, motor development, yes, baby turns from side to back, attempts to roll over, front to back, yes, baby attempts to roll over. Next, roll from back to front, spring up and down when sitting, right side patient picture, yes, baby rolls from back to front. Next is fine motor, hand may be opened or closed loosely, holds a rattle deeply fine place in the hand, carried hand or object to mouth at will. Manipulate small object, being to bend object that are hold. Right side patient picture, baby holding his hand, hold article briefly find place in the hand. Yes, baby will manipulate small object. Next third point is sensory development. Baby turns head to side when the sound occurs at ear level of baby. Eyes following move person nearby. Localized sound made above the ear. Right side patient under patient picture sensory development. Baby's eyes close move person nearby. Second, yes, baby moves following sound. Next, fourth point is psychological development. Under psychological development, mutual regulation of mother and infant, trust occur by mother caregiver smiles back in response to another smile. Right side under patient picture psychological development. Yes, baby trust occur by mother caregiver. Next, fifth point is spiritual development. They cannot able to recognize the faith. Right side under patient picture spiritual development. The baby cannot able to recognize the faith. Next, sixth point is intellectual development. 1 to mouth, primary circular expression under patient picture, intellectual development. The baby's primary circular reaction is good. Next, seventh point is moral development. Pre-convention morality. The good is what I like and I want. Right side patient picture. Under patient picture, moral development. The baby does not know what is good or bad. Next, 8 points. Language development. Recognize familiar word, vocalize syllabus. Under patient picture, language development. The baby is neonate, so baby cannot produce any word except crying. Next point is unoccupied play. It indicates no play activity in the Visual sense of word under patient picture unoccupied play. Yes, baby. Yes, because the baby's age only 2 years. Next point is investigation. Under investigation, so many tests is there. First is bilirubin blood test, glucose test, ABO typing, CRP, and CSB. Next is medication. First medication is paracetamol. Doses 500 mg, root oral frequently PID. Mechanism of action. Paracetamol has a central analgesic effect but that is mediated through activity of descending serotonergic pathway. Contraindication: caloric undernutrition, liver problem, acute inflammation, acute liver failure. Indication: headache, migraine, sore throat, backache, rheumatic pain. Side effect: wheezing, tight chest or throat, trouble breathing, swallowing. Next, nurses' responsibility: nurses should provide proper medication in proper time. Nurses should maintain proper documentation. Next medicine is acetaminophen. Doses 3.9 gram. Root oral frequently TID. Next, mechanism of action. The reduction of the COX pathway activity by acetaminophen is through to impede the synthesis of prostaglandin in the central nervous system. Then contraindication: hypersensitivity, severe hepatic impairment, severe active hepatic disease, and indication is headache, minor pain of arthritis, cramp, mucosal ulcers, fever. Next is side effect: red peeling skin, rashes, hives, itching, swallowing of the face. Next, nurses' responsibility. Nurses should check the expiry date of the medicine. Next is nursing diagnosis. Risk for impaired skin integrity related to racking pruritus, acute pain related to skin lesion and irritated mucous membrane, imbalanced nutrition less than body requirement related to infection condition as evidenced by loss of appetite and diarrhea, deficient knowledge related to new disease condition, impaired social interaction related to isolation from friends, high risk of infection related to the host and infectious agent. Next is nursing process assessment subjective data. Baby's mother says that he has fever since 2 days. Objective data: skin redness, productive cough, rashes, diagnosis. Risk for impaired skin integrity related to racking pruritus. Risk for inflammation related to compromised immunization system. Goal: skin will stay clean, dry and intact. Mucous membrane will stay moist. Prevent the spread of infection. Next is planning. After 8 hours of nursing intervention, we will be able to patient illness and stability for learning, formulate their strategies for facility of better learning implementation, assess respiratory rate, monitor vital signs, assess client health, frequent deep breathing exercises, exercise, and effective tapping while in upright position, administer medication is indication, misses evaluation, oxygen saturation maintains decrease in infection, verbal feedback, and physical demonstration. Next point is health education. Teach parents about signs and symptoms of measles, to teach about fluid intake, to give proper rest and sleep, to make child to sleep in bed, evaluate at 30 degrees to is easy the feeding. Keep your child away from others, especially people who have never had measles or an MMR shot. Stay up to date with all recommended vaccines. Next is conclusion. Babies of Jammu who admitted in hospital with the chief complaint of the baby was fed in with rashes, cough and fever since 2 days back. After doing all the diagnosis, he has diagnosed with measles after providing care for 3 days of have and positive attitude towards the disease condition. Next is bibliography. या फिर जो बिब्लियोग्राफी है आप खुद से लिख सकते हो जो बुक से आप सोर्स से कोई अदर सोर्स है तो उसका लिख सकते हो आपने जहाँ से हिस्ट्री कलेक्शन किया वही आप बिब्लियोग्राफी